Hello friends, today I'm going to show you a very interesting PPT of a positive finding which I did last year. She must be now 33 years old. When she came to me, she was 32 years old and her high-risk HPV-16 was positive. Her pap smear was also HSIL, and the most important thing about her history was that her husband was a drunkard and had a multiple sexual partners. She had come to me from Uttarakhand, so that particular day she wanted everything to get the things done. That is the colposcopy. So I'm showing you here the findings of the colposcopy after the acetic acid application. So, and we are going to use the SWEDE score also. So you can see that whole of this is densely aceto-white area. Whole of the cervix is completely occupied by the densely aceto-white area, and you can see the margins. So the score for the densely aceto-white is 2. You can see the sharp margins almost all over. Here especially you can easily see the sharp margins and the sharp borders. And multiple abnormal vessels you can see. So for the abnormal vessels score was 2. For the aceto-white, for score the sharp margins. For your sharp margin, again the score was 2. And then you can see it is occupying almost whole of the cervix. Not even is no place except this border was left. And then finally, when we applied the Lugol's iodine, you can see the canary yellow area in the upper, at least upper half of the cervix. I did the biopsy from all the quadrants and the biopsy report came out to be HSIL. In fact, I thought it will be the micro-invasive carcinoma. The report will be micro-invasive carcinoma, but it came out to be HSIL, which matched the PEP, which was again HSIL, or we can say on the biopsy, it was CIN3. And here I'm showing you, this is colpo-directed biopsy I'm taking. So you can see that this is a positive finding and how it looks like. So we should be able to understand, first of all, the normal colposcopy. In normal colposcopy, again, I'm emphasizing that the type of the transformation zone, then you see in the green filter, nowadays blue filter is also available for seeing the vessels clearly. Then you apply the acetic acid and then finally, so nowadays as per guidelines, we are supposed to take the biopsy from the least suspicious area also. So we did the 4 quadrant biopsy, all came CIN3. You can see from this also that if we go for the LEDs in this patient, even for the LEDs or conization, there's almost no area, space left for such. I would have ended up in doing the amputation in fact. This patient, because as I told you just now, she is from Himachal Pradesh. She wanted hysterectomy. She said she could not avoid her husband and his drunkard and multiple sexual partners. So she could not come repeatedly for the follow-up, for the colposcopy, for the pap smear, or even high-risk HPV DNA. So we did the hysterectomy on this patient. So just an interesting case for you to learn and understand.